Today is the beginning of World Antibiotic Awareness Week, which is an idea that raises awareness of the threat of antibiotic resistance and then the importance of appropriate use of antibiotics. I have with us today Dr. Chris Whitman with Mobile Infirmary to talk more about all of this. Thank you so much for being here, Doctor.
Thank you, Shelby.
So first of all, what is World Antibiotic Awareness Week?
World Antibiotic Awareness Week is a week-long campaign that starting today that goes through next Wednesday, organized by the World Health Organization to increase awareness about antibiotic use and the resistance that is happening with the inappropriate use of antibiotics. So at Infirmary Health, we are promoting Antimicrobial Awareness Week throughout our entire hospital system. So you may notice blue lights at all three of our hospitals. We're engaging our employees and staff throughout the week with different games and activities to try to increase antibiotic awareness as well.
And we've heard about this more and more, it seems like, year after year. Antibiotics are great and they're good, but why is antibiotic resistance such an issue?
Yeah, so some bacteria learn how to evade and become resistant to the most common antibiotics, antibiotics that we've been using for decades and decades there. So now these superbugs are becoming more and more prevalent in our community, and antimicrobial resistance is one of the top 10 health threats here in the U.S. today. Worldwide, over 700,000 people die every year to multi-drug resistant bacteria. So with this, we are running out of effective antibiotics, and resistance is increasing faster and faster than we can find new drugs. And so it's essential that we keep these life-saving antibiotics, working to use them now and for our future generations. Yeah,
that is essential. So how can we prevent this resistance?
Yeah, so to prevent this resistance, everybody has a role throughout our entire healthcare systems, our patients. Then antibiotics, they work against bacteria. They do not work against viruses, parasites, fungus. So some of the most common infections that we see every day, whether it be the flu, the common cold, sore throat, even COVID-19, antibiotics do not work against these infections. And given antibiotics here, just a single dose or a short course can go ahead and start harboring these resistance genes inside of you. Then when we do have a bacterial infection later down the road, you're more likely to have a multi-drug resistant infection. So very important there that we're using antibiotics appropriately for bacterial infections. They're powerful drugs, and they also have some potential negative side effects as well. So when prescribed an antibiotic, patients can ask their doctor a few questions. One, is this the right medication for the infection? And important too, what's the shortest course of therapy that we can use for these antibiotics? Some infections, simple skin infections or urinary tract infections that used to be treated by 14 days, we can sometimes treat these now for as short as 3 and 5 days. So it's important that we're using the right antibiotic, but for the shortest duration of therapy. Then also important not to, when you're finished with your antibiotics, and if you have any, should finish the entire course, but if you have any left over, not to save them at your house or save them for a family member or a child. All infections are different, so make sure that we're using the right antibiotic for the right infection.
Absolutely. Dr. Whitman, we are out of time, but real quickly before you go, is there any place folks can go to kind of learn about this more?
Yes, you can go to the CDC website. They have a lot of great information on antimicrobial stewardship and awareness, and the World Health Organization has a great website as well.
All right, all good information, definitely very important. Thank you so much for being here with us today.
Thank you, Shelby.